Casualty Insurance Company, affiliates, and third party.
Hey, Cudahy to all my friends and relatives in four directions. This is Robert Pilot of Native Roots Radio presents I'm Awake. I'm here to ask you for your support. Finding honest Native-centered news is not easy. But with your support, we're able to provide accurate information about Standing Rock, Line 3, treaty violations, and COVID-19 in our Native communities. Please visit Native Roots Radio Network on Patreon and donate if you can. That's Native Roots Radio Network on Patreon. Pinigigi, and thank you for your support.
This is Chase Iron Eyes announcing a new show on AM 950, the progressive voice of Minnesota, powered by Native Roots Radio. The show is called Native American Patriot Talk Radio. What will we do on the show? We are going to explore and dive into the source of American constitutional sovereignty, the intersection of Native American and legal issues. Find us the first and third Tuesday of every month at 6 p.m. on AM 950.
The city of Minneapolis is now on Native Roots Radio with Minneapolis AIR. AIR stands for American Indian Relations. Guest host Christine McDonald talks to people about important things affecting the city's Native communities. Minneapolis AIR dives into topics like public safety, public health, elections, and so much more. Tune in to Minneapolis AIR on Native Roots Radio from 5 to 6 p.m. on the second Wednesday of every month, right here on AM 950.
Oh, this is Robert Pilot. For Native relatives, healing is more than just sobriety. It's reclaiming Indigenous masculinity as a sacred, balanced force. Join Hunter Thundercloud for Native Roots Radio presents Controlled Fire. We explore how personal recovery uplifts our communities. It's time men step back into roles as mentors and spiritual leaders. Recovery is collective, and it starts with us. Tune in the first and third Wednesday of every month at 6 p.m. for Native Roots Radio presents Controlled Fire. Let's tend the fire together. Support comes from the Walker Arts Center, an art space that's more than spoon and cherry. Galleries celebrate contemporary visual art, including Indigenous artists like Edgar Heap of Birds from the Cheyenne and Arapaho nations, and Jim Demeny from the Ojibwe Nation. Additionally, film screens, cinema, and performances are shown on stage. And the Walker is free every Thursday night and free every day for citizens and members of tribal nations. Learn more at walkerart.org.
With your AM 950 weather, I'm Patrick Lilia. Tonight, clear with a low of 2 below, then Tuesday afternoon snow with a high of 23. Dinosaur World is taking over Children's Theater Company for an immersive tour where you can feel the roar and even smell their stinky breath. Get ready to face a T-Rex and be sneezed on by a Triceratops. Dinosaur World runs now through April 5th. Get your tickets at childrenstheater.org.
Portions of Native Roots Radio may be pre-recorded.
It's a good day to be Indigenous.
Get up, stand up.
They are going to become more brutal.
Couldn't cut, hitting cut again.
Because all the hippies were trying to be Indians anyway.
They're going to become more repressive because it's a matter of dollars and their illusionary concepts of power.
Hey, Victor.
We must live in balance with the earth.
And also with recent happenings at Wounded Knee.
I am awake. Welcome to Native Roots Radio presents I'm Awake, and I'm your host, Wakanja Hade. Hey, welcome all. Hey, Cudahy to all my friends and relatives in four directions. You are listening to Native Roots Radio presents I'm Awake, and I'm your host, Robert Pilot. Hey, we discuss local, national, Native news and events. And as you know, Native issues are human issues, and human issues are Native issues. Hey, we got Dr. Stately coming on today, but first I want to read a message out here. Nick Tilson released the following statement. Today I'm free. My freedom wasn't guaranteed by a judge, a jury, or a settler colonized court system. My freedom was won by the people, the movement, and the ancestors. We organized, praised, wrote, called, and fought these politically motive charges in integrity, deep principles, and strong beliefs. So a big shout out to our friend Nick Tilson of Indian Collective. Just a really amazing. Glad, one of the things from the beginning, Indian Collective was uplifting this case as a blatantly political motivated effort to silence a movement leader by criminalizing his actions and misusing the legal system. And so really, really good news. Congratulations, Nick, and big shout out, one win for Indian country. And again, Nick, we're going to get you on the show here very, very soon. We have our friend Dr. Stately coming on today, and also Wendy with her sacred animal part here. And that's welcome, Dr. Stately. Dr. Stately, welcome. And wow, I'd love to discuss that big article that you had in the Minneapolis paper. Really great, well, a lot of good information there, and I think some things maybe we should talk about. But congratulations on that article talking about access to healthcare.
Yeah, thank you. I appreciate that. Yeah, it was really lovely. Actually, I didn't even know the article had been released. Some Angie DeLille from the Department of Health and Human Services texted me this morning and congratulated me on it. And I was like, what article? So
I know, and I have the Minneapolis paper, so I didn't even see it. But I think Friday I was worried about the snow Sami and the Armageddon of the snow. So I was preoccupied in not reading the paper thoroughly.
I think that was like, so okay, the storm was like, I don't know. They made it sound like we were like, remember the TV show about or that movie, that classic movie about like the end of the world when like New York was getting flooded and what was it, 20 anyway, I can't remember the name of it anyway. Something Day.
Google it.
Yeah.
Oh, Judgment Day.
Judgment. No, I think that's something even just a little bit more violent, I think. But the point being is like everybody, like I went to the grocery store to get groceries, because I'm like, oh, I'm going to be snowed in for a day. And I know I didn't have like, some basic things that I would need to like make sure my kids could eat for a couple of days. Right.
Yeah.
And I got there and there's like nothing on the shelves. I was like, is this the pandemic again? Are we like,
yeah,
it was like people were actually, I mean, I think that people were like reacting to the scale of the problem. And it's not that it wasn't a huge problem. There were like 14,000 plus people who were out of no electricity over the weekend in Minneapolis specifically, which was really probably challenging. But I was like, okay, this is a little bit overdone, but and you're gonna laugh at me. So I was looking for hamburger because my kids wanted like tacos for the weekend. And I went to 3 stores and I could not find one roll or one thing of hamburger. I was like, this is crazy.
I could have borrowed you some of that vegan hamburger we have here.
There you go. I probably should have looked for that. But anyway, so no tacos for them this weekend. But we did get to shovel about 16, 17 inches of snow. It was like crazy. So yeah.
Wow. We didn't get that much, but today it's always kind of a bummer because it's colder and the plows plow my car in the alley, and we pay them to plow the alley but not plow me in. But one of the good things I realize is I'm in really good shape for an old man, so I was happy to be able to shovel it. Really, think about it.
Well, that's good. Yeah.
What's the alternative, right?
Yeah. I mean, I started shoveling my driveway and it was heavy. I mean, it was heavy snow. So I shoveled some of it the night before when it was like powdery. And I was like, oh, this is going to be easy. So I woke up the next morning and it was way heavier. And I did about half of the driveway, maybe a third. And then finally I was like, gave up, and one of my kids came out and said, can I help you? Should I help you? And I said, absolutely, you should help me. So the other ones didn't want to come out, my nephew and my other son. And I said, okay, if you guys want to go anywhere today, like if you want to leave this house, you're gonna have to shovel this out because I'm not doing it. I can stay here until it melts.
Yeah, you can work on it. Yeah, definitely. Well, I made sure when we bought this house that it was not a corner house because I grew up in a corner house, and in a big driveway. So I have bad memories of that.
Did you always get like snowed in a corner house, or?
No, we had a big snowblower, so I guess it wasn't too bad. bad, but it was a lot for me to start the snowblower, but that's, I'm kind of similar to your kids at the same age. I just want to say that I kind of avoided work and, in a good way. Oh, wow.
Wow, that's interesting. I'll have to talk more with you about that.
How did I snap out of it?
Offline, yeah, offline.
Yeah,
So,
exactly.
no.
I'm not sure. I guess I'm the only one that knows to run the snowblower here in this family. So
yeah, I was like watching my neighbors. I live across my neighbors across the street are all snow blowing their things, and and here I am, this frail old man, like shoveling my own snow, and not one of them offered to come over and snow blow my yard, my driveway. Last time it snowed this much, the neighbor across the street came over and asked me if he could snow blow the part where because I had shoveled the night before, and then the plows came through and then blocked me in again. So he came over and did that, but that was kind of.
Well, we are at that point in March where it's going to be 60 degrees Friday, so I'll be on the boat Friday, but today I'm hiding in the house.
I know. Well, I was trying to figure out, like, could I wait until Thursday for it all to melt, and then I could just leave. But
Get away.
I probably
Definitely.
My mind being stuck in my house with my kids.
Not to get too crazy, but Mitzi is saying the struggle is real. I like that. Thank you, Misty. Appreciate it.
The
struggle is real. Thank you for noticing that here for 2 senior citizens that are still working. Right.
And I think that, like, I always just thought, like, I'm never, I'm fine. I'm strong. I'm still, like, pretty active, and, I haven't worked out for a few years. So I was like, but I can, like, shovel some snow. So I didn't buy a snowblower, like, the last few years. I actually did buy a cheap one a few years ago, and it worked one time, and then it didn't work again after that.
Wow. Hey, we're here with Dr. Stately, CEO of Native American Community Clinic, and more snow talk here after this short break. Please stay with us.
The city of Minneapolis is now on Native Roots Radio with Minneapolis AIR. AIR stands for American Indian Relations. Guest host Christine McDonald talks to people about important things affecting the city's Native communities. Minneapolis AIR dives into topics like public safety, public health, elections, and so much more. Tune in to Minneapolis AIR on Native Roots Radio from 5 to 6 p.m. on the second Wednesday of every month, right here on AM 950.
This is Chase Iron Eyes announcing a new show on AM 950, the progressive voice of Minnesota, powered by Native Roots Radio. The show is called Native American Patriot Talk Radio. What will we do on the show? We are going to explore and dive into the source of American constitutional sovereignty, the intersection of Native American and legal issues. Find us the first and third Tuesday of every month at 6 p.m. on AM 950.
Support comes from the Walker Arts Center, an art space that's more than the spoon and cherry. Galleries celebrate contemporary visual art, including indigenous artists like Edgar Heap of Birds from the Cheyenne and Arapaho nations, and Jim Demeny from the Ojibwe Nation. Additionally, film screens, cinema, and performances are shown on stage. And the Walker is free every Thursday night and free every day for citizens and members of tribal nations. Learn more at walkerart.org. I heard sex trafficking happens a lot in Indian country. What is that?
Here are some of the real reasons why sex trafficking happens in Indian country. Unequal gender roles that were forced on us by colonization. Communities don't have enough resources. Silence around domestic and sexual violence. Lack of attention and justice for missing and murdered Indigenous people. There's a lot of behavior that keeps our communities out of balance. These are just a few true reasons why Native communities are targeted by traffickers. When these acts of violence happen in our communities, it opens us all up for exploitation.
Sponsored by the Minnesota Indian Women's Sexual Assault Coalition.
I'm Lieutenant Governor Peggy Flanagan, and I want to be your next United States Senator, and you are listening to Native Roots Radio.
Welcome back to Native Roots Radio Presents I'm Awake, and this is Robert Pilot. Hey, welcome back, everyone. This is Robert Pilot, and we are here with our friend Dr. Stately, CEO and President of a Native American Community Clinic here in the Twin Cities, Minneapolis, and we're discussing a little weather here, and, we like to do that here in Minnesota. Also, I just want to give everyone a quick shout-out, too. Chase Ironrise tomorrow at 6 p.m. right after Native Roots Radio, and stay tuned. He's on a couple times a month, and, man, does he have a lot to say, and rumor has it Dr. Stately's going to be having a show similar coming up. No, he's not. He just put up the whisper. No. Okay. So, hey, we are here with Dr. Stately. Okay, you are muted. I'm going to try and unmute you. And I don't think I can. Only you can. But we're here.
Sorry.
Good job. Good job. Hey, let's talk a little bit about that article. I think there's a lot of good information. I read that today, and I think some of the biggest barriers Native people face is in the urban areas is simply navigating the healthcare system. And I think you guys, I don't know if you have the secret sauce, but you definitely know how to navigate our relatives here in the Twin Cities.
Yeah, I think the article speaks a lot about like the model of care that we have, and it also speaks a lot about the work we do to connect people to all of the services that all the support services that they need to sort of generally and broadly have better health outcomes. So we know, like as an example, so I think the article speaks a lot to like I should be really transparent. This was a article that was a sponsored article by Blue Cross Blue Shield, who is one of our partners in the work we've been doing over the last several years, especially over the last 2 or 3 years with our expansion of our clinic and some of our clinical models. They support our, they gave us funding for our traditional tobacco program that we operate, which will help you incentivize you and support you in wanting to quit smoking. And a few other things, but one of the things that they also supported us with last year was helping to fund our patient advocates and our navigators. So those patient advocates and navigators, they help our relatives in the community. Hold on one second. Can you guys be quiet? Oh, sorry, scolding my kids.
Yes, that's good. Live on radio.
We're like, we get 1,000 aunties to call them. I'll put their phone numbers in the chat.
Yeah.
There you go. But one of the things that they help the navigators help you do is like get you insurance. So sign you up for Medicaid, sign you up for MNsure, which is like a state-sponsored reduced insurance plan if you can't buy on the open market or the commercial market. I think and this is a really critical issue for us specifically right now. Most of you know probably that the big beautiful bill has gutted Medicaid and made some significant challenges for people to be able to be covered. It's already changed some of the requirements for 2026. The big impact will come in 2027, which is right around the corner. But when it comes time every year to re-up for Medicaid and renew your insurance plans, which everybody has to do whether you work or not, you have to renew those plans.
Mm-hmm.
And then the challenge becomes it can be very confusing to people to figure out like how to figure out which entity or which insurance plan should I get, which one is the right one for me and my children and my family, which one do I qualify for, all those kinds of things. And a navigator can really help you with that process because it can be a very really confusing process. I've been alive and using health insurance for a good 50 years now because I started working when I was 16. So, but 40 some years. And it's been challenging to even navigate that process for somebody me. And I have a PhD, and it's like they can make it very difficult, right? And so our navigators help you navigate that process. Pick the plan that's going to work best for you. They'll sit down and figure out all those things for you. The other thing that group does, our patient advocates and navigators, will help you with linking you to housing services, food shelves, the things that you also might need to support your family and your well-being, and just navigate all those things that are really difficult to do. And those are things that are, that you will put aside sometimes. You'll put aside your health care if you have other more pressing issues like your rent and like, your food, those kinds of things, childcare, these kinds of things that are can be really problematic. And we want people to get the health care that they need and deserve. So we invest heavily in that program.
I might be swinging by because I turned 65 in May, and there's not only the there's things that I want and I want to pay for, and some of them are dental. That doesn't come with the normal things, and prescriptions. I do a couple pills a day, just to stay happy.
Yeah, when you do have a transition in your life between 63 and 65, when you kind of move towards like being eligible for Medicare, that it becomes a little bit different to manage too. So if you're once you become a senior like you, and you become eligible for Medicare, you need more support, and we're here to help you with that.
Yes, and thank goodness I could still thanking the stars that I was able to shovel. So I was not like in a bad mood. I was like, okay, I can still do this at 64, almost 65 years old, and I know some people can't.
Yeah, no,
Whatever
absolutely.
reason.
Some people, a lot of people can't. And so, those are real things. I would tell you that, like, you should be careful, shoveling heavy snow. Get some support. Don't you have some young ones around, some kids in the neighborhood?
No.
Grandchildren. Oh, they're too young to shovel yet. They're only 1 or 2 years old. So
Yeah, they're two, but we'll get them out there soon. That's for
yeah,
sure.
start them out early. Like, just give them a little shovel and do a couple snowflakes, because you want to train them by the time they're 16, so they actually, come to your aid when you need them.
Yes, and how to clean the boat too. This is fun, I read Tom Sawyer as a youngin'. This is fun. Let's paint this fence. I couldn't say it.
Oh my Lord. I don't know what to tell you about the fence. I have I remember about that book was just a little bit racist, I think.
Yeah,
I'm in the middle of something. Hold on a second.
Yes, Dr. Stately is conducting the people that are his roommates at his house. It's fun to watch, right, Dr. Stately?
Shoot, these are not roommates. Roommates actually help and support. These are like these are like barnacles.
Yes, yes.
Barnacles. Staying with the boat theme here. Barnacles hanging on.
That was good. Yes. Yeah. Don't go up too far north. It'll spread them out, and check your boat and your motor for those barnacles.
Yeah. Sorry. They need critical
okay.
help.
Well, I think what I got from that article too is there's a high percentage of our natives in Minnesota. There's higher rates of us not knowing, and are still uninsured. So that's a major issue, and that was brought up in the article.
Yeah, we have. So actually, we've seen since 2024. So last year in 25, we've seen it probably happen. We're going to see even a bigger rise. Significant number of people who are falling off insurance. So the number of uninsured rates, the rate of American Indians that are not on any insurance plan, healthcare insurance plan, is higher this year than it was last year. It's gone up about 10%. The average for the state, somewhere that rate looks closer to like between 4 and 5%. So, I read that, I get upset, I get concerned, of course, because these are the people that we serve at NACC and other health systems here in the Twin Cities. But also one of the things that I think is important is that it also didn't surprise me tremendously, because I kind of sort of already have, we at NACC have been seeing our own uninsured rate of people that we serve going up a little bit higher than it's been in the past. And so, it didn't surprise me. And Native people across the state of Minnesota, a lot of things related to health care, any condition, we just end up being higher than most other populations for all kinds of reasons. There's all kinds of reasons why that's true. There is such a thing as structural racism within healthcare systems and other larger systems, but there's also things like, related to that are a subset of that, which is like, health literacy is a real thing. Like if you can't make things understandable and easy to access. I'll remember during the pandemic when, people were just covered continuously for about 3 years because during that period of time. So when there was the big shift and you had to change and you had to re-up and you had to do all those things, the mechanisms for doing that were really challenging for people. A lot of it was done electronically. Some people don't have internet. They don't have phones. They don't have these things. They've moved several times or they lost their housing when they were there. So their addresses weren't active. So we have a lot of work in Minnesota and especially within Minneapolis to sort of help people get enrolled in insurance. And that's going to be a big part of our work over the next several months.
Right on. Hey, we're here with Dr. Stately. We got one more segment with Dr. Stately. This is Native Roots Radio, and we'll be right back after this short break. Please stay with us. Support comes from the Walker Arts Center. Local artist Rosie Simas, Seneca Nation of Indians, Huron Clan, embodies Onondaga philosophies of peacemaking and relationality in new immersive installation. Visit Age Jagwa Desnigowaweni. I hope it'll stir your mind and explore a space built for communal rest and contemplation. Simas presents a performance of the same name this May. Learn more about the exhibition and performance at walkerart.org. Oh, this is Robert Piloy. For Native relatives, healing is more than just sobriety. It's reclaiming Indigenous masculinity as a sacred, balanced force. Join Hunter Thundercloud for Native Roots Radio presents Controlled Fire. We explore how personal recovery uplifts our communities. It's time men step back into roles as mentors and spiritual leaders. Recovery is collective, and it starts with us. Tune in the first and third Wednesday of every month at 6 p.m. for Native Roots Radio presents Controlled Fire. Let's tend the fire together. Support comes from the Walker Arts Center. Did you know that the Walker has a cinema that shows film almost every week? From artist talks, genre-defined performances, and world premieres to archival shorts and experimental soundscapes, the Walker Cinema explores all modes of global and local filmmaking. Get your first tickets for free. Visit walkerart.org/cinema to learn more. That's walkerart.org/cinema. See you at the movies.
When we heal from our traumas,
When we face our fears,
let go of our addictions,
when we relearn our values,
when we live our teachings,
respecting our elders,
cherishing and honoring our children,
when we honor and take care of our spirit,
there will be no room left for sexual violence.
Sponsored by the Minnesota Indian Women's Sexual Assault Coalition.
The city of Minneapolis is now on Native Roots Radio with Minneapolis AIR. AIR stands for American Indian Relations. Guest host Christine McDonald talks to people about important things affecting the city's Native communities. Minneapolis AIR dives into topics like public safety, public health, elections, and so much more. Tune in to Minneapolis AIR on Native Roots Radio from 5 to 6 p.m. on the second Wednesday of every month, right here on AM 950.
This is Chase Iron Eyes announcing a new show on AM 950, the progressive voice of Minnesota, powered by Native Roots Radio. The show is called Native American Patriot Talk Radio. What will we do on the show? We are going to explore and dive into the source of American constitutional sovereignty, the intersection of Native American and legal issues. Find us the first and third Tuesday of every month at 6 p.m. on AM 950.
Support comes from the Walker Arts Center, an art space that's more than the spoon and cherry. Galleries celebrate contemporary visual art, including indigenous artists like Edgar Heap of Birds from the Cheyenne and Arapaho nations, and Jim Demeny from the Ojibwe Nation. Additionally, film screens, cinema, and performances are shown on stage. And the Walker is free every Thursday night and free every day for citizens and members of tribal nations. Learn more at walkerart.org.
With your AM 950 weather, I'm Patrick Lilia. Tonight, clear with a low of 2 below, then Tuesday afternoon snow with a high of 23. Warmer weather is on the horizon, and what better way to welcome it back than with a fantastic meal and a show at Crooner's Supper Club. Crooner's is located in Fridley on Highway 65, just north of I-694. Check out their concert schedules and dinner menus at croonersmn.com.
AM 950, the progressive voice of Minnesota.
Oh, this is Dallas Goldtooth, and you're listening to the Native Roots Radio. Hoka, hicha, wecha.
Welcome back to Native Roots Radio presents I'm Awake, and this is Robert Pilot. Hey, welcome back, everyone. This is Robert Pilot, and we are with our friend Dr. Stately, Native American Community Clinic President and CEO. Welcome back, Dr. Stately. One of the things I don't know if we've ever really talked about, we kind of joke around, and I was joking around about shoveling, but you know, preventive medicine, where does that lie with our community and your clinic?
Well, I mean, I think preventative medicine is part of the range of services that we provide. So we provide, when we say comprehensive healthcare services at NACC, we do a whole range of those things. So you're going to see your vaccines, your screenings, those kinds of things. We really focus on those efforts a lot across the spectrum. We also do, comprehensive care around, healthcare, your chronic disease management, diabetes, high blood pressure, any of those kinds of conditions. In the dental range, you're going to see, we encourage people to come in and get their screenings for their teeth, get their teeth, regularly examined and cleaned. And, we have lots of health fairs that we go to. We have a couple that we sponsor here in our own space. And we've had these historically in our parking lot. We didn't do that this year because we are putting a building in our parking lot. But we'll do things like kids' teeth and those kinds of things. So we do all a pretty fairly good job, I think, of offering comprehensive healthcare. I think one of our biggest concerns, and one of the things that I certainly have as a concern of as a leader of the organization, is that we have some of the lowest vaccination rates in the state of Minnesota, and that's been true for quite some time, right? So trying to do more work in that area, encouraging people to bring their children in and get your vaccines regularly and consistently is a really important thing for us to do. So
yeah, that's awesome. I
spotting at my nephew is trying to walk behind me.
yeah. Hey,
this is evidence that you don't get actually brain development happening until well into your 20s.
Well, I would even argue 30s now. Oh,
yeah.
Wow.
I think that's probably what the trajectory I'm on, which is.
It's not the fireman, is it? Your nephew, the fireman?
No, not that one. Good Lord, that one has a brain.
Oh, wow. Well, that's awesome. When we talk about that, it's so important. It's interesting though, when you said that, we have the lowest vaccines rates. I know when COVID when the first vaccine came out, it seemed like Indian country was leading the way. vaccines.
Yeah,
And,
I mean, I think a lot of that can be explained by the fact that we had a lot of effort that we were putting into that process. We like when COVID kind of happened. We were doing pop-up vaccine testing for COVID all over. Just not just in our clinic, but we were doing it all over across the Twin Cities. We'd do it over in schools. We were one of the first organizations to actually leave our space and go out into the community and do testing, and then also delivering vaccines, access to vaccines early on. And one of the things I think that is different about that is that middle of a crisis at that moment in time, so people who I think were really motivated. But even when that was happening, we still had lower rates than we had higher rates than everybody else, which is great, getting it accomplished. But we had lower rates, and we did have a lot of people we lost during COVID. But also, like, people forget. I think they forget. They have other issues and other priorities that take the place of like doing things like bringing your children in every year for child check and getting your vaccines updated, coming in and getting your breast cancer screening or your colon cancer screening or your this screening or that screening. All those kinds of things, they kind of fall to the wayside when we're really busy, or we have a lot of busy life things. If you're a parent of a bunch of small children, it's really hard to manage that, right? And so that's some of the things we have to.
Well, one of the things that is interesting to me, I think some people are playing video games in your house, and we're losing you. But one of the things that was interesting to me as a teacher, now our scores were somewhat low, and what happened was we would put a lot of effort, hire more teachers for math, and our math scores would go up. But that's because we put money into it, and I think that's one of the things that are lacking in Indian healthcare is that they aren't putting money into it, and the proof's always in the pudding,
Yeah, well, there's I think a lot of things that contribute to that. That certainly is one. I mean, Indian Health and Indian Health Services, so IHS, both in the supportive tribes and also urban health clinics like ours and like Indian Health Boards. Those things have been underfunded significantly for like decades, right? And some of those. Some money has been invested during the Obama administration, but in Biden's administration, he's significantly increased it. That there were some efforts, I think, in the recent administration to try to sort of curtail some of that, but we were successful, I think, in being able to mitigate that or minimize the impact of that. But the funding for Indian Health has been significantly under-resourced for decades. So that's a big challenge because it takes staff and it takes resources. One of the biggest concerns I have as it relates to vaccines specifically is like, the administration at the highest level has really created some challenging processes around that. They've made confusing statements publicly about it. Robert Kennedy Jr. Has taken some very basic vaccines off of the schedule that Medicaid will cover. So 60% of the Native people in the state of Minnesota covered by Medicaid. That means you're not going to have access to, that means anywhere else outside of NACC, you would possibly, or other community health centers, you wouldn't necessarily have access to vaccines. What that means for us is we have to find another way of paying for them because we're not getting reimbursed through Medicaid to provide vaccines to people. But we're still going to do it. We're going to find a way to do it. We're going to buy the vaccines ourselves. It'll cost us a pretty penny to do it, but we're going to provide those things because they are life-saving for many of our families. And, it reduces the likelihood that they'll get significant, they'll get infections or catch diseases that are easily avoidable just by having a vaccine. Measles is on the rise. All kinds of things are on the rise.
Unbelievable. Yeah. And I bet you $1 all his kids are vaccinated, you know.
Oh,
And
you know that these billionaires, they go and get all the stuff that they downplay, and they say like, oh, we're not gonna, all their families are just fine. They go to, they go get their vaccines when they get their Botox treatment.
hey, when we have a blue tsunami and push our relatives that are running and winning, I really believe that if we can drop $1 billion worth of bombs in 24 hours, that we can afford healthcare. Period.
Yeah, I was talking last week. I did a presentation to individuals that were part of this. Their college students are getting ready to go into medical careers, and so it's part of this. They come and they visit our community every year, and we talk with them about the work that we do at FQHCs. So NACC is one of those FQHCs, and I talked about how the challenges that confront us in the Native community and across Turtle Island are as much political determinants of health drive some of those inequities much more than social determinants of health. So they asked me the question, like they said, like, well, what do you mean by political determinants of health? That seems highly charged statement. I said, I want you to remember that in 3 or 4 years ago, when there was a pandemic and everybody was at risk for dying, it rained money from the sky. So the lack of money isn't really the issue here. The lack of having the capacity to direct money to address an issue is not the issue. The issue is like whether or not you think that saving certain lives are important or not. And so part of it becomes like, and I said this, like, we just dropped billions of dollars of bombs over the weekend last week. And certainly during this week, we're going to continue that. That's like, think about the countless numbers of people that would help if we redirected those resources towards health and well-being. I said, healthcare is probably one of the most important things we provide to the communities across our entire country here. But it's we invest the least in it of all wealthy developed countries. That tells you a lot about where we are politically around this issue.
Yeah, I always said, especially before COVID, I always said, make one less B-1 bomber and let's get a universal health care. I mean, it's as simple as that. And we have to have our politicians and push our politicians to do this, because you're right. During COVID, it was raining money on a lot of different ways, and they found money for a lot of stuff, and they're finding money for bombs now and recouping bombs because they're running out or running low. But this is something I hope that we can keep on talking about when it comes to, just mental health and healthcare across Turtle Island.
Yeah, we need just desperately to win back some of those.
Looks like Dr. Stately's frozen again. I think what happens is sometimes the kids are at home and they play the video games, and it sucks down some of that internet. Dr. Stately, thank you so much for coming on.
Yeah,
and
that bandwidth. I think it's effects of the storm. I was like this all weekend.
All right, cool. Hey, thanks for coming on. We'll talk to you very soon.
All right. Thank you so much. Take care.
Right on. You too.
Hey,
this is Native Roots Radio. This is Native Roots Radio. Up next, Wendy with their Sacred Animal Update. We'll be right back after this short break. This is Robert Piloy. For Native relatives, healing is more than just sobriety. It's reclaiming Indigenous masculinity as a sacred, balanced force. Join Hunter Thundercloud for Native Roots Radio presents Controlled Fire. We explore how personal recovery uplifts our communities. It's time men step back into roles as mentors and spiritual leaders. Recovery is collective, and it starts with us. Tune in the first and third Wednesday of every month at 6 p.m. for Native Roots Radio presents Controlled Fire. Let's tend the fire together. Support comes from the Walker Arts Center. Local artist Rosie Simas, Seneca Nation of Indians, Huron Clan, embodies Onondaga philosophies of peacemaking and relationality in new immersive installation. Visit Age Jagwa Destiny Gowaweni. I hope it'll stir your mind and explore a space built for communal rest and contemplation. Seamus presents a performance of the same name this May. Learn more about the exhibition and performance at walkerart.org.
This is Chase Iron Eyes announcing a new show on AM 950, the progressive voice of Minnesota, powered by Native Roots Radio. The show is called Native American Patriot Talk Radio. What will we do on the show? We are going to explore and dive into the source of American constitutional sovereignty, the intersection of Native American and legal issues. Find us the first and third Tuesday of every month at 6 p.m. on AM 950.
The city of Minneapolis is now on Native Roots Radio with Minneapolis AIR. AIR stands for American Indian Relations. Guest host Christine McDonald talks to people about important things affecting the city's Native communities. Minneapolis AIR dives into topics like public safety, public health, elections, and so much more. Tune in to Minneapolis AIR on Native Roots Radio from 5 to 6 p.m. on the second Wednesday of every month, right here on AM 950.
Hi, it's Dr. Evan Adams, and you're listening to Native Roots Radio. Hey, Victor, you better be listening.
In this portion of the show, we'd like to bring awareness to our wolf and bear populations throughout Turtle Island. Say no to the hunts.
Hey, I want to introduce my awesome and beautiful wife, Wendy. Wendy's been an animal advocate for many years and is a co-founder of Native Roots Radio. And we're in our 10th season. And welcome, Wendy. A lot to talk about today.
Yeah, thanks, Robert. Hey, everybody. My name is Hanaji Hihani, and that means cares for them. And I was given that name by my Dega, Curtis. Curtis goes by Mashke Hanajinga, which means walks on white clouds. I'm a policy volunteer for Humane World for Animals, and I work on animal issues at the state and local level. And I will be at the state capitol tomorrow talking to my senator and representative about a few different bills that we want to have passed. And these are humane bills that we want to have passed in Minnesota. But before I get to that, I want to talk about what happened yesterday at Ridgland. It's RIDGLAN, Ridgland Farms, and they're located in Dane, Blue Mounds, Wisconsin. Now, what this place is, it's Ridgland Farm Incorporated. They are a place, a facility that breeds beagles. They breed beagles in order to experiment on them, and they breed beagles for other places to use for experimentation. A whole group of wonderful, brave, courageous animal advocates went there yesterday, Blue Mounds, Wisconsin, to the Ridgland facility, broke in and started taking the beagles out and bringing them to freedom. But before I say that, I just want to say that this place, Ridgland Farms Incorporated, has been cited for hundreds and numerous animal cruelty charges, and they are due to shut down July 1st. But in the meantime, guess what? They get to continue their breeding program and their experimentations on these poor dogs. So
another 4 months.
Exactly. I want to give a shout out again to these fantastic animal advocates that were so brave. There were so many of them. I saw somewhere where they said that there was close to 100 people there just trying to get these dogs out. The good news is they got 22 to 23 dogs in a rescue house, and they are safe and they're being cared for. The The bad news is that the police started arresting the animal advocates, and took 8 of the dogs. Yeah. So they took 8 of the dogs. We don't know what they're doing with the dogs. And we are all calling. Like today, I called the Dane County Sheriff's Office, and I asked them, "Hey, please release these 8 dogs." You could call them too if you want. They're open tomorrow. I believe you could leave a message as well. I'll give you their phone number in a minute. Get you a second to get a pen. But you could just Google Dane County Sheriff's Office. Their phone number is 608-284-6800. And just call them and say, please release these 8 beagles to adoption. These 8 beagles were taken from activists while they were carrying them to safety. And just let them know that this is important to you, and see. Did you need that number again, Robert?
Please.
Yeah, the number is 608
Mm-hmm.
284-6800. You know, it was funny. I went on, I just Googled it. I can't even say it. It's Ridglan, RIDGLAN, Ridglan Forums Incorporated. So this is what their website says. I just want to read this to you. Let us help with your research needs. Customer service is our number one priority. Our mission is to provide purpose-bred beagles for research that increases and exceeds the experimentations of the research community. Gross. We are USDA Class A dog breeder, which honestly means crap. I'm telling you right now, the standards are garbage. All the dog needs to do is be in a cage and be able to just turn around. That's it. That's the standard. Okay. As well as a USDA licensed Class R research facility. We are committed to the highest standards of health and quality, which is backed by our bunch of letters, blah, 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 international accreditation for animal care and welfare. This is a garbage facility, and I'm glad that they're being shut down July 1st. In the meantime, the dogs are stuck in there, being bred. They're not really taken care of. They've never seen the light of day because they've been in this facility for their whole life. And it just really, really gets me mad. So I just want you to know about that. So if you feel moved by this story, if you like beagles or dogs in general, give the Dane County Sheriff's Office a call and let them know that you want the dogs released to rescue. I'll give a shout out again and again and again to these animal advocates that went there and got the dogs out. Facing harassment, facing arrest. Many of them were arrested. So we don't know what's going to happen to them, what charges will be brought to them, but places like this, they want to set a precedent. So I'm sure that they are going to make things difficult for these animal people. So anyway, that's the story about that. I kind of wish the woman I know who did this, she's on Facebook, and I just said to her, I want to give you a hug. And she was like, yes, I would love a hug from you. And I might see her tomorrow. I don't know if she'll be at UMaine Lobby Day at the state capitol tomorrow, but I'll give her a hug. I'm also going to tell her the next time you do something like this to let me know, because I want to get involved. At least I could, I might not be able to crawl through a window and crawl in because I'm 65 years old.
Oh, I think you can.
I think I probably could, right?
Yeah.
But I at least could drive one of the cars, and transport the dogs and, get them out of there. And, I would risk arrest, to help and to stand up for something that you believe in,
Yeah.
So.
Yeah, definitely.
Yeah. So anyway, so they I've talked about this many times on the air. The reason why most of dogs that are used are beagles, and beagles are they're a good size. They don't weigh too much. They're not too big. They're not too small. They're kind of in between. Their demeanor, that's the main thing, is that they're very, very loyal and very, very kind and docile. And yeah, exactly, Robert. And, they're very easily manipulated, even if you're hurting them or, causing them pain and discomfort. They're going to kind of just take it and go along, So
call that number again. We got less than a minute when.
Oh, yeah. Let's have that number again. It's 608-284-6800. Give the Dane County Sheriff's a call tomorrow and just tell them to please release the 8 beagles to adoption. These 8 beagles were being taken, they were just about to be put into a transport car to get to go to safety, and they were snatched by the sheriff's department.
Call
1-608-284-6800.
Let them know, release these puppies. These are our relatives, and this is so horrific that this goes on and on and on.
Thanks, Robert.
No, thank you, Wendy. Hey, have a good time tomorrow at the
main lobby day at the Minnesota State Capitol. Yes, I will. We have 75 people signed up, so that's exciting.
Right on. Hey, this is Native Roots Radio. Hopefully, I'll see you tomorrow. Ho!
The city of